And the panel to follow will include Imtiaz Perzada, Jim Funk, Columba Wilson, and Ian Schlescher. So they can be ready and up front if they'd like to be. So this panel is Andrea Brower, Jessica Trudeau, Benit Musaki, and Joy Rawls.
Hi, I'm Andrea Brower. I'm with Texans Care for Children. I'm the Early Education Policy Associate, and we are a statewide advocacy group that works to improve policy outcomes for children. I'm here to talk about the child care licensing issues in the staff report. Excuse me. And I want to say we support recommendations 4.1, 4.2, 4.3, and 4.4 and agree that implementing the changes would strengthen enforcement and increase safety. Also, we agree with recommendations 7.1, 7.2, and 7.3 and believe they will boost efficiency for both providers and the agency. With respect to issue 4, the report found that the third most frequently repeated violation in child care centers and also one of the highest risk violations was that a caregiver at a daycare operation failed to adequately supervise children. In addition to enabling the agency to initiate administrative penalties and develop an enforcement policy for such violations, steps could be taken to reduce some of the root causes of these repeat violations. For example, excessive caregiver-to-child ratios leads to an increased likelihood that children in child care centers are not adequately supervised. Research has shown that when caregivers have too many children to supervise and the group size is too large, the likelihood of injuries and illness in children increase. In 2010, DFPS's Child Care Licensing Division conducted a mandated review of standards and concluded, with this statement in the Texas Register, the agency does not believe that the current standards for group size or ratios adequately protect the health and safety of children in some age ranges. It's been difficult for advocates to understand why the agency has failed to act after making that statement. DFPS's minimum standards allow 11 2-year-olds to be assigned to one caregiver and 15 3-year-olds to a single caregiver, ranking Texas as 49th and 50th among all states for most age ranges. We're very far from best practice recommendations of the National Association for the Education of for Young Children and of the American Academy of Pediatrics. Though we agree that we must take into consideration the impact of the child care industry when considering a change to ratios, it's still the agency's primary responsibility to follow the statute, which says it is the policy of the state to ensure the protection of all children under care in child care facilities and to encourage and assist in the improvement of child care programs. I would urge the Commission to make a management recommendation to DFPS to phase in reduced child-to-caregiver ratios over a number of years, thereby decreasing the burden on family and providers. This was a recommendation that DFPS posed in 2010 and withdrew due to the economy, and they said that they wanted to repropose it when the economy rebounded, and they never have. I think doing this will help the agency meet the above charge and improve safety in licensed child care centers. Thank you, and I'm happy to answer any questions.
Ms. Brower, thank you. I haven't had time to read your written testimony, but what are the best practices or ratios that you're referencing in your testimony?
I can submit them.
That'd be great. I mean, I'm just curious what you gave some numbers of what currently is the case with DFPS, but when you reference the best practices ratios, I'm just curious how far off, in your opinion, they are.
I know for 2-year-olds, the American Academy of Pediatrics recommends half of what we have.
And you said 13?
We're at 11.
Okay.
Yeah.
That's okay. You don't have to submit it right now. I'm just curious about it, and if you don't mind, and you can put your hands on it, if you would give it to us, I think the Commission would be interested in seeing it.
Mr. Chairman?
Yeah,
Yes.
certainly.
When you bring that information, could you also bring the correlating cost to the consumer? To cut it in half is going to increase that cost quite a bit to, I think, our working parents.
Yeah, it's a tough one to figure out, and I know that's what the agency has struggled with because, of course, there's quite a bit of variation in costs across the state, and there's varying amounts of profit, and depending on how many subsidized kids you have in a center. So this is an issue that's been worked on for years. Advocates came together in 2012 and proposed a plan, a 2020 plan to bring these ratios down, but that's why folks, because it is difficult, that's why they recommended the phase-in approach to help businesses and families with absorbing these costs. And even the recommendations that were made back then, they weren't to get us to best practice. They were to get us to maybe average, instead of being 49th and 50th, could we be 25th among states? And, not just for ranking purposes, but of course for safety purposes.
I understand.
Yeah.
I have a son who's raising his kids on his own, and cost of daycare is extremely high, and that could basically just put him where he can't do it anymore.
Yeah, I understand. And we continue to do some research on this, and we're looking at comparing states, similar to Texas, and how can 49 other states manage to do this? I'm sure that their costs, we're not comparing ourselves to the East Coast, it's neighboring states, and somehow, not all the child care industry went under. So we feel like there should be a balance between the needs of children and the needs of providers, and I feel like we've been more heavily weighed on what providers and businesses need rather than what children need. It's not only a child care safety issue, it's a learning issue, and I know that has been given a lot of attention lately, but 0 to 3 in child care, that's a learning environment too. It's not just pre-K. So we should keep that in mind when we're trying to, on other levels as well for future workforce needs.
Yeah.
But yeah, thank you, and I'm sorry if I went on too long, and I will definitely get that. I have it in here, so if after she goes, I'm happy to tell you what the other ones
Thank
are.
you.
Yeah,
Really
strong
appreciate your
support.
testimony.
I'll save time for that.
Okay, yeah.
Do you have any other questions? You're great. Okay. Thank you. Ms. Trudeau?
Yes. So my name is Jessica Trudeau. I have good morning on my sheet, but it's now good afternoon. And I want to thank you for the opportunity to offer testimony. So I offer this testimony as the Executive Director of Family Compass, we're a child abuse prevention center in Dallas, and we are a McVie-funded organization, co-chair of our local Family Violence Prevention Council in Dallas County, and the recommendations have the endorsement of the entire council. I have a master's in public health from Tulane University with an emphasis on and expertise on how to evaluate maternal child health programs. And as a professional who formerly managed the dissemination of funding from the state level to nonprofits, so opposite of what I do now for the Louisiana Department of Education. I'm also a survivor of child maltreatment and would have benefited from prevention programming, so that's very close to my heart. So today I'm testifying in opposition to the proposed sunset recommendation to move the federally funded McVie funding, including and then the additional funding for the Nurse Family Partnership from Health and Human Services Commission to the Department of Family Protective Services. The Health and Human Services Commission is doing an exceptional job of evaluating the impact of programming and ensuring that we are in line with the benchmarks that HRSA has set forth. As I mentioned, I have a master's of public health with a focus in this area, so I can speak with some degree of expertise in addition to being a recipient of one of the funded organizations. I have deep concerns that if the funding moves to the Department of Family Protective Services, who does not have the capacity to evaluate at this level, or is not evaluating the programs that are existing under the PEI division, that we will be unable to provide the information to the feds that indicate that we are both effectively monitoring our progress towards the benchmarks, but also making progress ourselves. That would cause us to potentially lose the funding and have a failure to draw down funding in the future. Additionally, the programs funded through McVie, including Nurse Family Partnership, do and are effective at preventing and providing early intervention for child maltreatment, but they also work on many other indicators, including children's social, emotional, medical health, and the pursuit of academic opportunities for those children and parents. This includes services that help families move out of cycles of poverty, such as job readiness. The Department of Family Protective Services does not have expertise or experience in such programming, and my concern is that the families would ultimately suffer. Lastly, $62 million has been cut from DFPS in prevention programming over the last 14 years. The families will ultimately, the families that we serve, the 13-year-old mom that my agency is providing services to, will ultimately be impacted if the funding is cut. So, thank you.
Thank you for your testimony.
Sorry, I didn't leave time.
Vineet?
Yes, good afternoon. My name is Vineet Mansukani. I'm here to testify about Child Protective Services. I have the dubious distinction of being an alleged perpetrator in 3 cases. Case A in September 2010 is the one that is still unsatisfactorily resolved, and which is why I'm here. Case B, for background, about 12 months later in August of 2011, was piggybacked on a police complaint, which was immediately dismissed. Therefore, the CPS case was also dismissed. But this is part of a consistent pattern. The expert noted I have a very healthy relationship with my two daughters, but nevertheless, in that same 12-month period, there were 5 other police complaints and 3 attempts in family court to truncate my visitation with my daughters, all of which were dismissed. But despite this consistent pattern, about 12 months thereafter, after that, in December 2012, case C was filed, this time only with CPS, and immediately after ignoring contradicting evidence, a finding of physical assault was made against me. It took 8 months to get the records. It cost me tens of thousands of dollars in legal fees during that period to fight, to be able to maintain a relationship with my children. After the 8 months, the findings were reversed. I have been recognized as an outstanding father by various organizations. Some of the observations I want to note here is within 10 days of the start of investigation of case A, the CPS caseworker was very satisfied with how I was taking care of my children solely during that period. However, 20 days into the process, family court reversed the custody arrangement, and within 40 days after that, CPS caseworkers, despite their own intuition and initial observations, decide to do a 180-degree reversal and go with family court. This is a persistent pattern that I've seen in support groups over and over again. Finally, when dealing with these kind of complex psychological issues, experts have testified that even candidates with doctoral degrees with specialized training have a 95% error rate in blaming the wrong parent. Therefore, in conclusion, number one, cases like case A in my case have exhausted all procedural process, but for example, I was never even interviewed once in that case. And also CPS in its own self-assessment report that they filed with you notes that on page 16 and 17 that this process of theirs completely violates constitutional due process. So here I am tainted by a finding which is in complete violation of the fundamental constitution of this land. Finally, number two, in these kind of divorce cases where there is no removal of children involved or there is no immediate threshold of physical abuse to the children, when the CPS is dragged into these kind of divorce cases, they should choose to say that they're clearly out of their depth and they should make unable to determine or unable to complete determination. And after all, family court itself has a whole section of family court devoted to protecting the interests of the children, and they're best off leaving it to them.
Thank you, and thank you for supplying written testimony. We appreciate that. Joy Rawls.
Well, good afternoon. My name is Joy Rawls. I'm the Executive Director of the Children's Advocacy Centers of Texas, and we're the statewide membership association for the 68 CACs operating in our state. A little bit of background, CACs are statutorily codified in the Texas Family Code, and each year we partner through memorandums of understanding with every CPS region in the state. Over 600 law enforcement jurisdictions, over 200 district and county attorneys' offices, and countless medical and mental health professionals. I'm going to speak specifically to issue 5 in the report as well as recommendation 5.6. And I first want to underscore that we really consider ourselves truly a partner with the department through these MOUs, as well as our other team partners such as law enforcement and prosecution. The real intent of our collaboration and our model is really threefold: to ensure successful case outcomes for children and families by collecting good evidence through our forensic interview process, to provide and coordinate therapeutic recovery services and medical assessments for these victims, and most importantly, the heart of all of this is coordinating those civil and criminal justice systems and investigations. And I'm going to speak specifically to that because I've heard that dialogue happen over the last couple of days. And I think it's really virtually impossible to talk about child protection in earnest without talking about the criminal system, because in a lot of these cases, CPS is going to do an investigation on the civil side, but the criminal justice system also is going to investigate things that have a corresponding offense in the penal code. And if those two systems are not coordinating, there's a loss of information sharing. It can be re-traumatizing to the child and family. And quite frankly, efficiencies are lost in many ways because law enforcement may be picking up on good information and data that CPS isn't by virtue of what their role is in the system and what they're able to do. So I think what we're set up to do and have been doing in this state since 1989, starting in Amarillo, Texas, is coordinating multidisciplinary teams through these CACs. And it's a model that's really tried and true across the nation at this point. The recommendation 5.6 talks about how the department can better evaluate how we're being utilized, and I think that a lot of this goes back to just good data collection and getting good information out of the CPS impact database so that we can evaluate the children that we've determined need to be coming through CACs for this coordinated approach and forensic interview and team approach. Are they coming through our doors? And right now, we don't really have access to that data under the way that the current impact system is set up. It's in there, but it's hard to pull out. And we've had a lot of wonderful collaborative conversations with the department that I'd be remiss in not mentioning today about how we can better strengthen our partnership with them and figure out who are the kids that we're missing that need to come through this process, and also expand our footprint. We primarily see sexually abused children through our doors, but this model works for children that are victims of human trafficking, alleged victims of physical abuse, and children that are at risk for a child maltreatment-related fatality. So I'm happy to answer questions, and thank you for this opportunity.
Joy, thank you. And I just want to say how much I admire what the CACs across the state do. Big supporter of Children's Advocacy Centers. My wife is on the board of the Bridge in Amarillo, and I know its history with, being one of the pioneers, I guess, in terms of CACs. And it's a tremendous service to the children of the state, and I think to law enforcement and the job that they face in those situations as well. Thank you.
Thank you.
Mr. Chairman, can I
Yes.
ask a quick question?
Senator Shortner.
Thank you. You mentioned that you collaborate through MOUs with law enforcement and DAs and as well as CPS, of course. Where does the court-appointed special advocates fit in your opinion, with CACs?
So CASA volunteer, and I know I think got some folks here from CASA, so I don't want to speak too
That's
much on
fine,
behalf
putting
of
you
their
on the
model. We're neighbors with them. Actually, their office across the parking lot from my office. So we work very collaboratively with them. CASAs get appointed when a child is removed and put into foster care. Most of the kids that come through CACs at this point don't actually go into foster care. We serve about 40,000 kids a year. 75% are victims of child sexual abuse. And the majority of those do not go into foster care, which I think is a little bit of a misconception. I think there's an assumption that, well, those kids must get removed, and that's just simply not the case. So when our kids that come through our doors through the investigation process do end up in foster care, a CASA would be appointed in communities that have CASA programs. Did that answer your
Yes.
question? Okay.
Thank you very much.
Any other questions, members? All right, thank you all very much. Appreciate your testimony. Next panel is MTS Perzada, Jim Funk, Columba Wilson, and Ian Schishler. Thank you. Behind them for the next panel will include Russell Fish, Linda Frazee, Christine Gendron, and Sophie Phillips. MTID, and I'm sorry, I'm sure I'm...
Yeah, that's the
mispronouncing
reason
that
I'm here, what they call. As I say, pronounce my name, a lot of the people, they don't understand, My name is Imtiaz Pirzada.
Thank you.
The same way, the CPS, they don't understand, when we're talking to them. And they will come with some other things, And background, as a religions, everything's, our backgrounds. When we try to explain to them, who we are, and they don't understand to us, and they come with different confusing. And today, I lost my two daughters. They are living with right now they are living in the one criminal, the felony house, and we try to explain to ourselves, to the people. When your people, the CPS people, they come to us, they should understand who we are, which culture we coming from. So most of the CPS people, they are coming to our places, they don't understand, and they only come with the difference. They're creating the more problems for us, And today, because of that reason, I lost, they put my kids to the foster care, and my daughter was complaining, they would give him a lot of the medications, and they put him in the mental hospital 2 times, and they tell him, if they don't listen to her, they're going to send him to the Houston mental hospitals, and they will give them more punishments, And when they're trying to talk to us, about these problems, what is going on in the foster home, they get the more troubles. And when I try to complain to the what they call HHSC, and then I get more trouble from the CPS, and then they went to the court, and they are very close with the court people, with the judges also. And the judge give me the more problems, in that, because I complain about them to the high positions here. And we go through the lot, I didn't see my kids almost 2 years. I have supervised visits. Personally, I have the security license. I'm very, and I run what they call limo company. I don't have any criminal background, Now they took from me my kids, Now they are growing. The one guy, he is a criminal felony guy. And this is going on in the CPS, They don't understand anything. They put us, the different situations, not only me, a lot of the community peoples. And that's the main reason I'm here, to explain to you guys, to put some people there, so they can understand who we are. We are the part of this community also.
Thank you for your testimony. I appreciate that insight. Mr. Funk?
Hello, my name is Jim Funk. Thank you for having me. I've been a CPS caseworker since 1990. I've never asked for advancement. I've always felt my job was on the front line. I've raised my son, who I'm very proud of. He's a senior in college right now, and he's going to become a CPS caseworker. Looking from the inside and on the front row, I see a lot of problems within the agency, and I've heard a lot of people testify on different views. The main things I think is, of course, pay is grossly inadequate. It doesn't keep up with the standard of living. Attached in my packet is my personal pay stub, so you can see exactly what we get paid for someone who's been here for 25 years. I've been a worker for 15 years. There's no career ladder for me because I'm at the ceiling. There's no room for advancement at all. If I want to stay at the frontline level, that I'm done. Caseloads are way too high, causing burnout, and mean that children and families aren't getting the time and attention they need. We need to set a hard ceiling for caseloads. We also need all CPS degreed employees to carry some sort of caseload, 1 or 2 cases, so that the administration and the state office staff can actually not become out of touch with what the needs of the caseworkers, the children, and the families are. I think that's very important. The Stevens Group report made it clear that we spend 26% of our time spent with kids and families. This is caused by an overload of paperwork and policy making. This is 1 month worth of policy changes. This is 1 month. Nobody can tell me, I've been asked several times, how many policies we're responsible for knowing. We attached also, another problem is a punitive work environment. We're asked to work Saturdays consistently, work till midnight, to spend in the office with children overnight because they have no place for them to be. These things, and then I was told recently, and the email is attached also, that I must take leave for 2 weeks without planning a vacation or anything else. I respectfully denied to follow that request, but I was ordered to take 2 weeks leave after working for several months, mandatory Saturdays, working to midnight. And basically we need to decide who our clients are. Are they the kids? Because right now we don't interview, we don't talk to the kids, we don't follow their desires at all.
Mr. Funk, thank you for your testimony, and I was curious, you probably heard the testimony, maybe you were following it yesterday when the Stevens Group testified, and there were references to the survey that was completed by caseworkers. Did you happen to be one of the respondents? Did you fill that out?
Yes, I did.
So did the results surprise you at all, or were you pretty, I mean, were you surprised that, say money, even though it was in the top three, I think it was third on the list of reasons folks were dissatisfied.
I was
The work
surprised.
environment was high up on the list, and maybe dissatisfaction with management. And so I'm curious what you thought about that.
I was surprised, in my opinion, and I ask people all the time. The top one, in my opinion, is pay, and number two is caseload. Work environment is up there also.
So your personal view differs a little bit from the survey results.
Yes,
Okay.
a little bit, but those are the top three,
Sure.
and the top three are still the top three.
Right.
The order of them, I think, is, in my personal opinion, is different. Yes.
Okay. Representative Burkett?
Yeah, quick question. Your last comment was that y'all don't interview the children? I'm confused by that.
We interview them, of course. We interview them investigations and as a caseworker in PMC, but we don't spend like it says we spend 26% of the time with them. That needs to be higher. I was in a pilot where we had a caseload of 7, and we spent creative ways to actually spend time and develop relationships with those kids, interviewing them, find out what their desires are, and following those desires as best we could. Most of the time, their desires are to go back with family. Even no matter how long they're in the system, they want to go back with family. And we also need to do a better job at getting them with some sort of family or relative or somebody, hopefully so that they don't even get in the system in the first place. And
So you don't feel like that's part of this? Is that part of the screening, or should it be a part of the screening? Is that what you're trying to say?
it's part of the screening in terms of interviewing them, but it's not thorough. It's not thorough enough, and it can't be because we're bogged down with so much other policy stuff.
Okay. Then one more question. You mentioned that the administration should have at least one case. I think yesterday somebody mentioned that the folks that are doing mentoring are carrying cases as well. Is that what you're...
The mentors are, yes, the mentors are. We also have what we call a retention officer, but the retention officer is to help the new caseworkers work smarter. We really need a retention officer at the state office level to guide the policymakers into how to make either reduce the policies that we have, which my prediction is over 1,000, and make them more children and worker friendly.
So you're talking about the rulemaking policy. We all think about bills, legislation, laws, before you talk about the rules that the agency itself makes.
The rules of
When you
the
say
agency
policies.
themselves, yes.
Okay, thank you very much.
And my phone number is on the packet too. I would welcome anyone's phone calls.
Thank you, Mr. Funk. Appreciate your testimony. Ms. Wilson?
Good afternoon, Chairman, Committee. I would like the committee to know how difficult it is to protect the child, and especially if
Ms.
it's...
Wilson, I'm sorry to
Oh,
interrupt
I'm sorry. My name is Columba Wilson.
Thank you very much.
Well, I do it all. Anyway, I would like the committee to know how difficult it is to protect the child, especially if he relates to special needs children. They are more vulnerable because of their disability. They tend to be abused more often. I am a grandmother and legal guardian of 2 children. One is autistic and IDD, and the other one is also a special education child. In 2007, I made a call to CPS to report abuse and negligence of the parents. CPS closed the case. I had to go to court with an attorney and pay thousands of dollars. And the court gave me custody of the 2 children. Weeks later, the older child told me that he had been abused at the age of 6. The incident started at school. He was very small, and the abuser was about 3 times his size. We have to go to court, and the abuser was found guilty of a second-degree felony. He was sexually abused, of course. He was given the abuser was given only 2 years probation by Judge Laura Parker. The judge was very biased, and he did not care about the victims. The advocate for the JV told me to get over, because I complained, that no one cares, and to stop calling that office. These are the facts, and you have the case numbers in there. CPS did absolutely nothing. On July 12, 2012, I called CPS again, and I called the police department to report that the mom's boyfriend was giving the child alcohol, hitting him against the wall, and making him nosebleed. The child was 8 years old, and he's the one that's autistic. CPS closed the case. Again, you have the number. And on July 19, they reopened the case just to close it again. I was told by CPS that children like him are not believable because he was mentally challenged. Once again, I went to court with an attorney on July 27th. The trial spent thousands of dollars, and the judge stopped the visitation rights with the mom. So now mama has limited visitations. And then on July the 30th, the other child came to my house and said the boyfriend was hitting him so hard he could not even breathe. And October the 26th, he told me that the mother's boyfriend has abused him sexually. So at that time, he was in Clarity, a psychiatric hospital. The hospital did not report it, so I had to report it to the CPA, to the police department. I didn't even bother with the CPS. I spoke to Detective Wilson, Senator Urest's office, and the case was assigned to Detective Campos on November 21st, 2013. And she said to me, the mother's boyfriend denied the allegation, so the case was closed. Amen for that. Thank you.
Thank you. Appreciate it, Ms. Wilson. Mr. Shishley.
Hi, I'm Ian Schisler. I'm a volunteer with the Open Records Project. We work to increase organizational transparency with Internet tools. I'm here to speak for 5 people whose lives were destroyed by what appears to be a criminal enterprise inside Adult Protective Services. We've uncovered a pattern where isolated seniors are just systematically have their assets looted once they're detained by the organization. So I'm going to talk about a few specific cases. Michael and Eugenia Kidd owned a home in Collin County and had a large retirement account, owned a new Cadillac. Michael was taken by APS after he broke his hip. His wife refused to leave his side, and she was taken by APS as well. They were committed to an asylum an hour's drive from their home by a gynecologist that they never met, and were heavily medicated on psychoactive drugs. A guardian ad litem, a guardian of the estate, and an attorney ad litem were all appointed by the probate judge to be paid for by the kids. The guardian stopped house payments, stopped car payments, stopped insurance and property taxes, but then failed to file a tax return and posted notice to sell their house. So after 9 months in the asylum, Michael snuck into an office and called his former employer, Fox News, who initiated a series of stories. And he was almost immediately, the judgment against him was reversed by the probate court. and the couple was freed. So Charlie and Edith Fink owned a home in Dallas County, a ranch in Paris, and 4 cars, including a brand new Jaguar XJS. They had no children. Edith was taken by APS in a raid on their home in January. Charlie was taken 2 weeks later following a hernia operation. So he had a hernia operation. When he woke up from the operation, he was essentially in custody. He was committed to a psych ward by a doctor he never met. He and Edith were both incarcerated in an asylum an hour's drive from their home and heavily medicated. Before any looting could begin, Charlie's neighbor contacted Fox News and began a series of stories. The probate judge reversed himself and freed Charlie. Don Brannon, this is the last guy, earned degrees in math and psychology. He owned his parents' home debt-free and in Johnson County, and he had no children. In October, he fell off his roof. And when he woke up, he was in APS custody. So he was taken to about an hour away. Again, all these people are taken someplace far from their homes and their friends and relatives, heavily medicated, and no attempt was made to contact his brother, who lives less than 20 miles away. So the probate judge assigned a guardian to the estate, guardian of the person, attorney for the guardian, guardian ad litem, and attorney ad litem, all paid for by Don. The guardian confiscated Don's bank account and pension and defaulted on the property tax payments. So and again posted notice to sell the home. And this is all without sort of the people who this is happening to wanting this or ordering any of this. So I was going to tell you that we were still working to get Don freed, but as of yesterday, he's now back at home thanks again to the pressure from the news media. So, we'd love the news media to investigate every one of these cases, but why is something like that necessary? So we feel like.
Yeah, thank you for your testimony. Do you have written testimony you could provide with some of those details?
I do.
Okay, we would really appreciate that, and we'll distribute it among the commission.
Okay, thank you.
Very much appreciate that. Thank you. Next panel is Russell Fish, Linda Frazee, Christine Gendron, and Sophie Phillips. You'll come up to the front. Provide your name, who you represent, and we'll get started with testimony. The next four, after they finish their testimony, will be Deborah King, Cindy Holster, Jolene Sanders, and Larson Stalland. All right, Russell Fish.
That would be me.
Thank you.
My name is Russell Fish. I'm a volunteer with the Open Records Project. That's openrecords.org. You may remember us from the TOS cheating scandal that doomed Ann Richards' reelection, or the Dallas financial scandal that sent Superintendent Yvonne Gonzalez to federal prison, or the publication of the sex offender registry that uncovered massive failure of Texas sex offender probation. We are here today to testify against state-sponsored elder looting and its tax-funded perpetrators. The perpetrators appear to include rogue elements inside APS and DADS, for-profit guardians, for-profit service providers, and some probate judges. We will address APS and DADS today. The APS mission statement is to protect seniors from abuse, neglect, and financial exploitation. Our investigation seems to indicate that elements of APS in fact are abusers and exploiters of the Texas elderly. The committee staff and HHF self-report is concerned with the turnover of social workers, the underfunding crisis, and the legal restrictions imposed by the legislature. However, not once in either report is there any indication that report preparers actually interviewed senior Texas victims of APS or DADS elder looting. Unless APS and DADS are simply social worker jobs programs funded by the state taxpayers, the most important question to ask is whether they're actually helping or harming Texas seniors. The Open Records Project has requested the names of individuals disappeared and looted by APS and DADS. We do not expect to receive any information. As a result, we depend on whistleblowers for much of our data. These are courageous professionals that are horrified by the state-sponsored looting of Texas seniors and who take substantial professional risks to reply to openrecords.org and tell us what they know. In the cases we have exposed so far, we have been able to extract the senior survivors of incarceration and looting. This has been completely accomplished by volunteers. These are Texas taxpayers who have other jobs and choose to donate their time and money to do work that the paid caring professionals failed at so miserably. A key element to remember is that in all of the North Texas elder looting cases that received media coverage, they resulted in judges reversing themselves. Essentially, the judges said, "We were wrong, APS was wrong." Elder looting is so heinous and objectionable to the public that when exposed to sunlight, judges, APS workers, for-profit guardians all run for darkness. We suggest that this committee run for the light and direct the Texas Rangers to interview the victims of APS and DADS elder looting and report their findings back to this committee.
Thank you, Mr. Fish. Appreciate your testimony. I will have one quick question for you, which is, what is the most typical way for one of those guardianships to be instituted when, say, you have someone, Mr. Sichler gave a few examples of someone that, maybe doesn't have children and they go into the hospital or they have some sort of accident. Who initiates the proceeding?
APS will take custody of these individuals.
How are they notified of
If you go to the website openrecords.org, we explain the procedure. There's 4 steps to elder looting, and it's a very sophisticated process, and it involves lots of people, and it's required. We've been working on this for 4 years to kind of unwind this. We have fraud examiners that are working through the finances. There's Medicaid and fraud involved here. There's certainly fraud in some of the probate courts. But APS is the gatekeeper, and they depend on 4 types of informants to help them identify targets. We call them the marks, and these are marks because they have assets, they have houses that are paid for or have equity, and they tend not to have children. That makes them vulnerable. The people that turn them in, sometimes it's a disgruntled neighbor that is seeking retribution because a tree limb fell. Sometimes it is a relative, a grandson that grandmama won't give him money because he'll spend it on drugs. He'll turn grandmama in. Sometimes we've had a number of cases, including one yesterday, where home health care workers are turning people in. There may be some sort of relationship between these home health care workers and some of the for-profit elements. We're trying to understand that. Finally, there clearly is somebody inside some of these hospitals. Methodist Richardson is an excellent example. There's somebody that's tipping people off inside of Methodist Richardson, tipping off APS, saying, "We got a live one, come get them."
Thank you for your testimony. Yes, Senator Hinojosa.
I mean, have any complaints being filed with the agency?
You've got to be kidding. I mean, you got to be kidding. These are people that are criminals. When you go into court on these cases, and these are the only cases that we can find out about because somebody, a neighbor, or occasionally a relative has come over the transom to us. Otherwise, they're deeply, deeply covered up. You go into court and you have Adult Protective Services there, and you have the district attorney representing Adult Protective Services. Who are you going to complain to? Now, the Texas Rangers, that's part of their job, is to seek out corruption. Other than that, it's the feds.
Let me ask, is this happening all over the state or in a particular region? Or?
Well, since we are based in North Texas, that's where we have the most boots on the ground and the most volunteers. And those are the ones where we've actually gone into court. We've gone into the houses. We've gone and met the people. We've gone into the asylums. In some cases, we've snuck equipment in. We've gotten videos and so forth. We're hearing from Houston. We're hearing from San Antonio. We're hearing from Austin. And as there's more publicity, more people are contacting us. The reason that Rangers should probably be involved is to determine how massive is this.
I don't mean to cut you off. So I guess what we ought to focus on is on the process for appointing of guardianships.
Well, the first process is the capture. OpenRecords.org. I mean, we lay it out. This is how you capture these people, and then this is how you eviscerate them financially, and this is how you make sure they can't get out. This is how you take their assets. This is how you liquidate their assets.
But isn't a court involved in the process?
The probate court is definitely part of the problem, but the probate court can only deal with what APS brings to them. APS goes out, captures somebody, and then presents it to the court.
Check into it. Thank you.
Okay. Representative Burkett.
Yeah, quick question. In your testimony, you said that you had submitted an open records request but didn't anticipate response.
Yes.
Who was that submitted to? Is that to the agency or
to the agency?
The courts?
To the agency, not to the agency.
Why do you feel like you won't get a response?
We've been doing this for 20 years. So in the early days, people actually would respond to these requests, but what would happen is our people are sophisticated enough that we can do fraud analytics, and we can find where the law is being broken and people go to jail. And so the agencies have, just like the IRS and the VA, they're not going to respond. They will sit there and stonewall. So we don't expect anything. And but fortunately, we have whistleblowers, and that's how we find out what's going on. There are 50,000 employees inside Human Services. They're not all criminals. There's a small element of rogues. And it's that 99% that go, oh my gosh, these people are making me look bad. And those are the people that say, we need to get this to the Open Records Project, because they will either get it to Fox News or they might get it to one of those Senate committees.
Right. So have you submitted your Open Records request? Is it past the time period that is allowed?
No, it is not.
Okay, thank you.
Okay. Members, any other questions? Thank you. Appreciate it, Mr. Fish. Linda Frazee.
Good morning. Good afternoon. My name is Linda Frazee. I'm here as a member of GRADE, Guardianship Reform out of Arlington, Texas. I'm here today for my mother, Nora Frances Robert Testell, who has been declared incapacitated by ATS and the Tarrant County probate system, and who could not be here today to tell her story. You'll receive a blue packet. The first picture when you open it up is a picture of me and my mom. That was taken a year ago, and that's the last picture I have of my mom. In June of 2013, my dad, age 81, died suddenly. After my dad's death, my mom had an appointment to see a physician whose statement is enclosed. Because my mom had infantile paralysis when she was a child, polio. She has a heart condition. After relatives left our home, after my dad's funeral, I took her to the doctor. He did an exam and said that she needed rest, away, just peace and quiet after my dad's funeral. So he admitted her for a couple of nights in the hospital just so they could make sure that her heart regulated and everything. And I had no problem with that. After the first night, she started feeling better, which I was very glad, because I myself was riding the emotional roller coaster. I had just lost my dad, my best friend. However, on the second day, my dad's physician came in asking a lot of questions to my mom that, I didn't feel was appropriate, and besides, his bedside manner was horrendous, and it really upset my mom. He wanted my mom to go straight from the hospital to a nursing home. No, can you make arrangements? Nothing. I mean, it was just like wham bam, you're not leaving here unless this is where you go. As her daughter, I objected strongly, and so did my mom. We had told him that we had made arrangements with family and friends to help take care of my mom. We were also had also made him aware that my mom had a Fort Worth police officer living across the street from her that watched her like a hawk, everything. This was my first experience with APS. Several months later, I was at my mom's home when a lady drove up to my mom's house and identified herself as an APS worker. And she wanted to speak with my mom.
Ms. Frazee, I know that it's frustrating because of our time constraints, but we do have your written testimony. We will read it all, and I know it's difficult to provide that, but thank you for your time today.
It is, and I have provided some suggestions.
That's
like
included?
I say, this is my first time, so I hope they help.
And those suggestions are included in your written
Yes.
folders? Thank you. Thank you very much. Ms. Gendron.
Hi, my name is Christine Gendron. I'm the Executive Director of Texas Network of Youth Services. Thank you for the opportunity to testify, and I also want to thank the Sunset Commission for their hard work on this report. I know that they went to many lengths to get feedback from advocates and from provider organizations, and we appreciate that, and we're very pleased with the report overall. TNOIS is an association of organizations that serve youth and families in crisis. For that reason, today I'm going to focus on the issue areas in the report that affect those who contract with the department. Those are issues 3 and 6 about foster care redesign and prevention and early intervention. Our organization sits on the public-private partnership that oversees redesign, and we're very excited about the initiative as it addresses structural problems with the current system, many of which you've already heard about today. We're also aware that there are risks to the initiative, just as there are risks to maintaining the status quo. Many providers have concerns about redesign. Some of the smaller organizations are worried about whether they'll be able to afford to continue serving children. The rates that they currently receive are not enough, but they at least know what they're going to get, and they don't know what they're going to get under redesign. At the same time, some of the larger organizations are concerned about the financial viability of the model, as they're potentially interested in being single-source continuum contractors. For this reason, we agree with Sunset about the importance of studying the costs of implementation. The department is already doing this, and they recently entered into a contract for someone to do a cost study in response to requests from the public-private partnership. And so we're very comfortable with the way that things have been going and with where they're moving. As far as prevention, we strongly support the Commission's recommendations around prevention and agree wholeheartedly that its importance within the department should be elevated. PEI contracts for family counseling services, parent education, youth mentoring, and other services that prevent child abuse and neglect and that strengthen families. It's important that these services are contracted rather than provided by the department, because the whole point is to provide community-based services to intervene before a family has to interface with CPS. These services are designed based on research, and there are data that indicate that they're effective. We commend the Commission for recognizing and highlighting the value of these programs, and we were excited to hear the Commissioner make a statement yesterday that I think suggests that he's planning to move PEI out from under CPS. The report calls for more planning and community engagement. We, of course, support this, and we want to emphasize the importance of having providers at the table. I think that in the past year, we've seen improvements in this area at the department already, and so we're hoping to build on that momentum. Additionally, the report calls for the department to better use data, and we strongly support this. The department makes a good effort at collecting data which indicate that these programs are working, but you wouldn't know that unless you dig for it. Additionally, evaluation activities can always be improved, and we think there's some big potential with a little more investment to make Texas a leader in evidence-based programming for youth. Thank you.
Thank you, Ms. Gendron. Sophie Phillips.
Good afternoon. I'm Sophie Phillips, the Acting Director of Research for TexProtect, the Texas Association for the Protection of Children, and I am testifying today on behalf of TexProtect as well as a consortium of home visiting providers that we facilitate. I'm testifying in opposition to the proposed sunset staff recommendation to transfer both the Nurse Family Partnership as well as the state and federally funded Texas Home Visiting Program from HHSC to DFPS. We feel like both programs need to remain under the management of HHSC for several reasons. First, family support home visiting programs under HHSC, like the Nurse Family Partnership, address a range of issues that align more appropriately with the broad mission of HHSC. The programs provide a holistic approach and work to improve outcomes across multiple domains, such as maternal and child health, substance abuse, mental health, cognitive functioning, as well as self-reliance. They are much broader in scale than issues pertaining to child protection. Secondly, the legislature has supported HHSC's development of the comprehensive home visiting system since 2007 and has invested significant resources in developing infrastructure and oversight, staff development, data collection, and community and stakeholder engagement. Transferring the programs could result in a loss of this traction and create significant setback. Additionally, HHSC is a preferable agency to deliver these comprehensive home visiting programs because of the stigma often associated with receiving CPS services. Transferring all programs to DFPS could pose an impediment to both recruiting and retaining families in these voluntary prevention services. HHSC's home visiting service providers are perceived to provide more of a support rather than a report function. Furthermore, home visiting has been stable under HHSC. Historically, when DFPS must cut budgets, the prevention division is the budget that gets cut. Approximately $62 million of prevention funds have been cut over the last 14 years. These cuts have disrupted services and devastated programs. If programs are transferred and the trend continues, programs could see more devastation, leading to a reduction in efficacy and a decrease in the economic and societal returns to Texas. Finally, transferring the programs could put the current federal dollars for home visiting programs at risk. The current federal program, known as MCV, is set to expire March 31st of 2015 without Congress reauthorizing the program. We will need HHSC's leadership to assist in this effort. Over the past 5 years, HHSC has had the sole responsibility of applying for and securing these competitive federal fund grants and successfully have pulled down $60 million in programs for Texas. Transferring the programs and the considerable responsibilities at this critical point could pose a risk to securing future funding. Thank you.
Thank you, Ms. Phillips. Thank you all for your time. I previously called Deborah King's name. Is she still?
Mr. Chairman, can I just
sure.
direct one comment to her?
Sorry, Mr. Lewis, didn't see your light. Go ahead.
Thank you for your testimony. I know about the Nurse Family Partnership, and it's, I think, one of the most effective programs in the entire country, and you have data to support what you're accomplishing, and I applaud the whole group for their work. It's fabulous.
Thank you. And Erica Lee from Nurse Family Partnership is here, so we applaud her for all of her work. Thank you.
Thank you. No, that's great. Any other questions or comments, members? Thank you. Ms. King, are you still in the room? She had marked her sheet for the Department of State Health Services, so we are going to postpone that until we get to the Department of State Health Services and stick with DFPS at the present time. So the next panel will be Cindy Holster, Jolene Sanders, Lorson Stollard, and Gary Schill. Okay, that's fine. Then is Matoyer Ellis available? Ms. Holster?
Hi, my name is Cindy Holster, and I'm a member of GRADE. I want to thank you for the opportunity to testify before you today. I believe it is important to share my story with the Commission about an APS investigation which resulted in the death of my mother and the loss of her entire estate. My mother had been diagnosed with MS, and although her body didn't work, she was a happy, smart, and loving woman. This nightmare started when I put my mother in a short-term care facility because I was going out of town. When I returned, she had developed a bed sore. I took her to the doctor, and she ordered a wound care specialist to come to her home. I had many concerns about the quality of care and brought it to the attention of her home health provider. This resulted in allegations against me to APS. I was unaware of the investigation until I mistakenly received a call from the caseworker at APS informing me that the case was dismissed. However, she informed me that by law, they must refer the case to the state. Eventually, my mother became sick and was hospitalized with breathing issues. As we sat in her hospital room playing cards, we had no idea the scheming going on behind closed doors. That evening, I went home to take a shower. Immediately, she was taken down for a swallow test, which they said she failed. They immediately inserted feeding tubes and heavily sedated her so she would not pull them out. They had her doctor deem her incapacitated and served her with papers to start guardianship proceedings all that afternoon. 2 days later, as our family sat in court, we were told that if we spoke out, we would be removed from the courtroom. The guardian ad litem presented to the court untrue allegations that resulted in disqualifying me as her guardian and revocation of my power of attorney. They appointed my mother a temporary guardian of person and of her estate. The temporary guardian transferred her to a nursing home where she was over-medicated daily. She was unable to eat and quickly lost 50 pounds. While I was making frequent daily visits to the nursing home trying to save my mother's life, I was unaware the guardian of her estate was selling her rental homes, antique cars, and other precious family heirlooms. Before the actual estate sale, we were allowed 2 hours to purchase items we might want. We had to buy her underwear, socks, gowns, and family pictures, things that she needed in the nursing home we had to buy. The consequences of APS referring my mother to the court forced her into a guardianship. The ending result of this practice has changed our lives forever. My mother's life was lost way before her time. She had just turned 75. You would think that after her passing, the guardianship would end, but no. As I am laying her to rest at her funeral, her guardian is in a court requesting he be executor of her will. The courts ignored my mother's wishes and appointed him executor. He continued selling her home, 14 one-acre lots, and continued cashing her oil and gas checks until everything was gone. It appears a lot of these cases have many similarities. APS reporting to the state, over-medicating, deeming them incapacitated, placing them in a facility, and draining their estate. Thank you for the opportunity to share my story in hopes that you will change this practice of APS referring cases to the court for court-initiated guardianship. This practice is financially burdening to families, incapacitating people before they are, and most importantly, it is placing the very people that they are in charge of protecting from exploitation to be exploited by the court-appointed guardians and attorneys. Thank you.
Thank you, Ms. Holster. I appreciate that, and I'm sorry for your loss. Ms. Burkett.
Yes, ma'am. Thank you for sharing it. I can tell it was very difficult for you. And if you've got your composure back, what attempts did you make at contacting the agency? What kind of responses did you get?
Which agency?
Well, APS or DFPS.
Well, I was at my mother's washing her dishes, and my phone rang, and APS called me, but it was an accident. They were trying to call the home health agency social worker. And that's when they told me that it had been. So I didn't call them. They called me.
I mean, after this process, how long ago did this happen, if you don't mind me asking?
Well, she's passed away 3 years ago.
Okay, so in
So
the
it's
last,
about 4 years
have you
ago.
made any attempts in the last three years to file some kind of complaint? Was there a complaint process that was open to you?
No, I didn't file a complaint. I mean, she passed and
Weren't sure what to do?
yeah, I wouldn't.
Yeah. Obviously, part of our process here is to make sure that folks like you have an avenue where you can go, and that's why I'm asking these questions.
Well, I guess my complaint was more, APS closed the account. My complaint was more with the guardianship program and that sort of thing. And I was repeatedly told that if I complained to them that they could make it where I could not see my mother in the nursing home, which I went to visit her probably 3 or 4 times a day in the nursing home. I bathed her most of the time. They allowed me to come there at any time of the night, or I'm a night person, so I would go down there sometimes and watch movies with my mother. They'd be sleeping. She was over medicated, but I finally developed a relationship with them in the nursing home that they kind of had quit that. But when she passed, I was not able to go there, and for 2 days because of the ice. And I called and I told them that I wasn't going to be coming down, and they medicated her, and she didn't eat for those 2 days, and then she ended up in the hospital and then passed from there.
I'm sorry to hear that.
Thank you.
Thank you for sharing.
Jolene Sanders.
Hi, my name is Jolene Sanders. I've provided public comment online, but I'm here today to speak more about my experience with CPS and also to point out, I think, a few things that may have been left out of the report or some things that may need to be looked at. I'm from Austin, Texas. I'm here representing myself and my son. My son attended second grade during the 2012-2013 school year in East Austin Charter School. He received special education services there with the eligibilities of autism, ADHD, and a speech impairment. He was placed primarily in a self-contained classroom. This classroom was a converted storage room with a table and chairs. The room was actually still being used as a storage room. He had very little opportunity for inclusion. There was no monitoring, no traffic in the area. On April 3rd, 2013, I was called to pick up my son early from school because he was having a meltdown. When I arrived, he was distraught. When we got to the car, he told me that his teacher had picked him up, squeezed him, slammed him down in a chair, and made his lip bleed. My first response was to contact the administrators immediately and inquire about what happened. I was assured it would be investigated to find out what happened before pursuing action with CPS. 2 weeks later, nothing had been done, and I called a meeting with 3 other administrators. Still nothing was done, but I was assured there would always be a second teacher present in that room for the remainder of the year. On May 3rd, I arrived early to pick him up from school and walked in on a teacher screaming at him and throwing a chair across the room at him. There were not 2 teachers present. His teacher yelled at me, "He's all yours, you deal with him if you can," and walked out of the room. It was at that time I looked and noticed that there was another student in the corner sucking her thumb. The teacher had been left in this classroom without support to traumatize these kids. The teacher admitted to all events and was permitted to resign in lieu of termination and move on to another school. Both the teacher and administration have yet to be held accountable for ignoring our concerns. I immediately withdrew my son and reported the incident to CPS. I thought it was going to be an easy case. There were witnesses. The teacher had admitted to everything. CPS told me they would not investigate because I'd removed him from the school, and so he would have no further contact with the teacher or staff, and therefore no potential for additional abuse, so they did not investigate. I've come to realize over the last year, working with a number of other parent advocates, that this is very common. My first recommendation is there needs to be an alignment of family code and education code. Abuse that occurs in schools is far too often not investigated by CPS, but rather designated to school districts to address. What happens is the school conceals the incidents and nothing, there is no accountability. The kinds of assaults that are occurring in Texas schools, if perpetuated by parents or other individuals, would demand immediate attention of CPS. CPS should also be required to investigate all allegations of abuse in schools, even if the child has been removed. What's happening is abusive teachers and staff are moving on and perpetuating abuse at other schools, and the epidemic of teacher shuffling is recycling abuse in public schools. My final recommendation is that CPS should include in its reporting improvement component and data a plan to document and track reports of abuse by teachers in schools collaborating with TEA so that even if they're not CPS is not investigating, TEA can say there are a number of reports at school A, there are a number of reports with teacher A, maybe CPS is not investigating, but something's happening. Let's see what that is.
Thank you, Ms. Sanders.
Thank you.
Did you told us that Larson Stalland is not here?
He's not here. He wanted to be here, but we had to leave, and he didn't have an opportunity
Okay.
to stay.
All right. Just wanted to verify that. Thank you. Thank you for your testimony. Gary Schill.
Hello, my name is Gary Schill, and I own Peak Performance Martial Arts up in Cedar Park. For the last 17 years, we run martial arts programs, after school and summer camp programs. About 2.5 years ago, the licensing division of DFPS came at us regarding our exemption for our martial arts program for after school. After a 1.5 years and very costly battle, we finally got our exemption, but we're still seeing situations in the state where other martial arts schools that qualify underneath the single exemptions process the state has in play are not being informed by the caseworkers that that is an option. They come in very Gestapo-like, very threatening. We're going to shut you down. We're going to close you down. Bringing police officers in instead of just going and saying you can either get a license or you can go underneath the exemption path. And these are not happening. And so a lot of people are scared about losing their businesses, or they're scared about people coming in, customers seeing them come in with police officers. It's a very threatening situation. So one thing I would recommend is that the training needs to get down to the frontline people when the licensing division, when they're coming to talk to these business owners. A lot of times they don't know the real facts about what's going on. All they know is somebody's coming in, making a threatening statement, and they're concerned about their business and their livelihood at that point in time. Then their customers are concerned, why are there police officers coming in? Why is CPS licensing coming in? What are you guys doing wrong? And it leaves a bad taste in the customer's mouth along with the business owner as well. So the rules and stuff we've done with the directors, got all this stuff straightened out a lot of times, but the frontline people are not there. Just last week I had somebody call me who we had helped set up their after school program, went through all the licensing paperwork like ours is with our exemption, and they got a phone call last week saying their exemption had been denied. I told them to go back and talk to certain people. Somebody showed up yesterday and said, I don't know why they denied your exemption, because you qualify underneath this part. So you have two people in the same area that don't have the same information about what qualifies as an exemption and what doesn't qualify as an exemption. The first caseworker didn't even ask them, do you want to do an exemption or do you want to do underneath the child care licensing part? So that's the process they're dealing with, and there's just a lot of miscommunication, a lot of misinformation about what's going on with the caseworkers in the front line.
Members, any questions? Thank you, Mr. Schill. Appreciate your testimony.
You bet, sir.
Ms. Ellis.
Good afternoon. My name is Matoya Ellis Martin. I am here representing CASA, Court-Appointed Special Advocates today. Thank you for allowing me the opportunity to testify, and I also want to thank the Sunset Commission for their report, but we still feel that there's some issues that need to be addressed more significantly. Child Protective Services is set up to or designed to protect children from abuse and neglect, but when children enter the foster care system, there's some unintended consequences. Children lose a sense of normalcy. Normalcy becomes a fantasy rather than a reality. It's not normal for a child to age out of foster care. You heard from many of you today that have aged out of foster care. They age out without having independent or learning or being taught independent living skills, being provided with any hands-on training so they can enter the adult world and have those skills and survive. They are not in placements where they can cook daily or learn about budgeting or planning meals. They're not in those types of environments. So when they're released into, or when they age out of foster care, they can't and they don't know how to survive. We are hoping that the system can address those needs. They do provide some reading materials for them, but again, it's not hands-on training. Our local CASA program is trying to and attempting to address those issues, and we are providing training for those youth. We have partnered with community members where we take them out and they learn about resume writing from different business owners. They learn how to interview, and they actually go through a mock interview process with those business owners. They learn about budgeting and planning meals, and they cook a meal. They learn about banking and what it's like to actually open a checking account. They learn about leasing cars and apartments. So they're receiving that those hands-on life skill training skills. So hopefully that they will know when they go into society how to do those things. It's also not normal for a child to have over 30 placements while they're in the foster care system. There is no stability there. Children can't function. They're taken out of their communities. They're taken away from their families. They're placed over hundreds of miles away from people that they have any connection with, and that's not okay, and it's not normal again. CASA volunteers can have valuable input on placement decisions, and CPS would look to them for that input, and hopefully that would lessen some of those placement changes. It's also an issue with permanency for children, and it kind of goes along with the placement. If they don't have placement stability, then we can't find permanency for those kids as quickly as possible. Children are still languishing in the foster care system due to various reasons, but one thing is the adoption process. It's a long process. The goal and the rule is for children to live in a home with a potential adoptive parent for at least 6 months before the adoption is consummated. Sometimes that does not happen for years, and part of the problem is it could be caseworker turnover, the information is not carried over. It's also problems with a backlog of the potential adoptive parents getting the redacted case files. It's numerous things that happen, and children, again, are still languishing in the foster care system, and we want those issues addressed. We feel that children should receive permanency as quickly as possible, and even saying permanency for someone is not normal who's asked to receive permanency. So we just want those issues addressed and to be looked at by the Sunset Commission. Thank you.
Ms. Ellis, thank you very much for your testimony. Our next panel will be Dr. Jeff Smith, Rebecca Allen, John Bickle, and Jeremy Newman. Come to the front, please.